Good afternoon, everyone. Thank you for coming. My name's Penny. I'm the physician and provider liaison here at Verde Valley Medical Center. It is my honor to introduce you to Dr. Rich Charlebois. Dr. Charlebois, I also want to make an announcement that all people that are joining online, please know that you can go ahead and send any messages or questions that you might have through our chat. We do have Maggie that will be monitoring the chat in case you do have questions. So I know that we've gotten a lot of information out on our website, at different places in our community, at our local library. We continue to try to reach as many people, newspaper, when we have topics that we feel are beneficial to our community. So the reason that I had asked Dr. Charlebois is he has such a wealth of experience in not only in urgent care, where he is the current director of our urgent care. We have 2 up in Flagstaff and 1 in Camp Verde. And then he also has a great deal of experience in the emergency department. So who better to talk about urgent care versus the emergency department than someone who has lived it for many years. Dr. Charlebois, Charlebois, French.
Everybody calls me Dr. Rich. So.
Dr. Rich, okay. You know, he delivers high quality care, and here at NAH, that's one of the things that we take so much pride in, is having excellent physicians and advanced practice professionals that are able to meet our community's needs, the needs of our patients. And so that is one of the reasons that we do a series like this. So he has more than 26 years of medical experience, which is amazing in itself. He treats acute illnesses, specializes in urgent care medicine, trauma, and emergency medicine. He has earned his osteopathic medical degree from Western University of Health Sciences in Pomona, California. He then completed his internship and family practice residency at Downey Regional Medical Center in Downey, California. He's board certified in family medicine. He's a member of the American College of Osteopathic Emergency Physicians and the American College of Osteopathic Family Physicians. So I'm going to turn it over to our expert that will share some information. We do ask, if you have a question, please let us know. More than happy to answer those. If you feel more comfortable writing it down, we also have that available. And one thing I'd like to mention, we are streaming this live so that if people aren't able to attend in person, they can do this online. And then this will be uploaded to our YouTube channel. So if you have a family member, a neighbor, a friend that you think would benefit from hearing this particular information session, please let them know that it will be available on our YouTube channel for Northern Arizona Healthcare. So without further ado, Dr. Rich.
Thank you. Thanks for coming in, folks. As I mentioned earlier, before everybody got going here, this will be audio information, so I'll be asking for questions and votes and things like that. The point of this lecture and this conversation is about making a decision between going to the emergency room or in urgent care in the event that you needed health care on an urgent basis. Okay, that's really the crux of the question here. Do you go to, if something happens, you're injured or a family member is injured or sick, where are you going to go? Okay. Actually, go back one more if you don't mind. As Penny mentioned earlier, the NAH, Northern Arizona Healthcare, has 3 emergency rooms. They've got the mothership up in Flagstaff. They've got an ER here, and they've got the freestanding emergency room in Sedona. All of them are open 24 hours a day. And also, we have now 3 urgent cares, Camp Verde urgent care, and then there are 2 urgent cares up in Flagstaff as well. And those are open generally 8 to 6, with the Jasper facility up in Flagstaff being open from 10 to 8 as well. Next. So I'm going to present a couple of scenarios here and just get a little bit of feedback from there, just something to get you thinking about where you would go if you had one of these or a family member had one of these kinds of injuries. For example, sprained ankle. If you rolled your ankle playing pickleball or something along those lines, would you go to an emergency room for something like that? How about an urgent care? family doctor that can get you in a timely manner, right? How about chest pain? ER, okay. 911 to get there maybe, right? Depending on the scenario, right? Ear infection in a child or a grandchild or something like that? Would that be something appropriate for the urgent care, do you think, or the ER? Urgent. And a high fever. This one's always tricky because high fever, it's always a question of high fever and what else, right? What is going along with the high fever? Is it a high fever and an earache? Sure, urgent care is fine. Is it a high fever and an obtunded person who's not responding normally, that kind of a thing? That's potentially a 911 call, right? Next. So why does it matter? Well, every year, millions of patients are seen in the emergency department that could have more efficiently been seen in an urgent care setting or even a primary care setting. Emergency departments are really good at dealing with the worst case scenario in patients, the sickest of the sick people that are there. And that's really what their wheelhouse is. Choosing the right location can save you time, money, and it can actually save resources in the community as well. It's not really about trying to keep people away from the ER. It's just trying to figure out exactly where the right care is, the right place at the right time. Next. So let's back up a little bit and take a look at the big picture. Something has happened and you have to make a decision about whether you're going to call 911 or get to the ER yourself by your own transportation means, or are you going to go to an urgent care? Things that are most appropriate for 911 are things that are life-threatening and you want them to come to you. The advantage with 911 is they come to you wherever you are with the scenario, and they start treating and stabilizing a patient before they even get to the ER. They can start IV, get fluids going, give medications, stabilize bad injuries. If it's something that's still emergent, potentially life-threatening, but you have a little time to arrange your own transportation, that may be a judgment call about how you get to the emergency department. Things that aren't necessarily life-threatening right now, but really can't wait for a couple of days to get in to see your doctor, those are really the kind of thing that are in the wheelhouse for an urgent care setting. That's really what they're best at. So you may wonder, what can we actually do in an urgent care? And this is a kind of a summary of that. We have imaging available. We can take x-rays of limbs and things along those lines. We have the ability to sew up a laceration, sutures, or even staples, or even glue a laceration. We can take care of the tetanus shot you might need in that circumstance. Cough, cold, urinary tract infection type things. We're all over that kind of stuff. That's really very much in our wheelhouse. Skin infections, rashes. We have the ability to do some in-house labs, for example, strep throat. We can screen for that right there on the spot. COVID, flu, urinary tract infections, infectious mononucleosis, pregnancy. Okay, we can do all of those things right there on the spot. And if we need to, we can order lab work that can be done at the hospital or at LabCorp or Sonora Quest, and all of that goes electronically right to the lab that you need to go to and ends up also on your primary care provider's desktop. So let's run through a little more of a specific set of cases here, if you don't mind. Case number one, this guy woke up with crushing chest pain, right? Those words, or he didn't just wake up with a little ache in his shoulder, right? He's got crushing chest pain. Given a choice, should this person be calling 911? Should they be taking their own vehicle to the emergency room or having someone drive them? Or is this most appropriate for an urgent care? Who would think 911? Or the emergency room, drive yourself kind of a situation? And certainly not the urgent care, right? Ask Lindsey Graham. Too late, right? He died of an aortic dissection a few days ago, and that's what he would have had, is crushing chest pain at the time. Okay. Oh. This guy, case number two, he rolled his ankle playing pickleball. Pickleball, terrible sport, don't do it. Okay. Yeah. And rolled his ankle. He's got no exposed bones. If you look carefully at his fingers, ChatGPT made this drawing for me, this graphic. He's got more problems than an ankle, maybe, right? Just making sure it's all messed up around the picture. But, you know, the theme here is this appropriate for 911 call? No, probably not. Emergency room? Maybe after hours, you know, if it's bad and you can't bear weight on it, possibly then. It's definitely in the alleyway or, you know, appropriate for the urgent care. That's really something we would see all day long. We can take an x-ray of that, splint it if we need to, if it's broken, and handle that just perfectly. Next. Here's that child with fever again, right? And that's always that shades of gray on this one, because if it's a fever in somebody who looks like her, okay, she's looking around, she's cuddling her little teddy bear there and all that. But if it's somebody who looks sicker than that, somebody who's also short of breath with their fever, or somebody who's really confused with their fever, those are really emergency room visits, right? But my point with this slide is really to kind of point out that some things aren't so clear cut. Okay, next. This gentleman was playing pickleball too, but he cut himself. Right? He landed awkwardly. And this is, again, something, you know, that can be appropriate for an urgent care setting, right? Now, if this was gushing blood and he couldn't stop the bleeding, maybe more of a 911 call, or maybe a visit to the emergency room, especially if it's pulsatile bleeding that's, you know, from an artery of some kind. But in the urgent care, we deal with this all day long. We can do the tetanus shot, we can sew it up and clean it up and take care of it. Next. And case number 5. So this is somebody who's having sudden onset of fairly severe abdominal pain, right? This isn't necessarily somebody who's just got a little dyspepsia and doesn't feel particularly well. And cases like this are really kind of in between as well, right? This could be one call based on the severity of the pain. If the pain is really severe, could be an aneurysm that's ruptured or something along those lines. If it's relatively mild, maybe the urgent care is appropriate. So there are some shades of gray there. All right, so let's talk a little bit about what happens if somebody needs to get into the urgent care. We have a process online with a phone call or walk-in where somebody can get an estimated time for their appointment. Okay, and that's easy enough to do online with a phone call. If you want to walk into one of our urgent cares, you're probably better off doing it earlier in the day, because we do kind of get busy towards the end of the day, but that's a process that can work. When you walk in, you'll be greeted by somebody with a smile on their face who welcomes you and will get your name and your information and get your medical record all set up. And then after that, the medical assistant will take you back to a room. The medical assistant will check your vital signs. They'll go over your medication with you to make sure that they've got an accurate list of all the medications you're taking. And then they'll get a brief summary of why you're there and come out and let the provider know. The provider will come in and see you next. They'll get a history. They'll examine you. They'll figure out what's going on, do any testing they may need to get, and then start the process of treating you so that you can feel better. Next. What happens in the ER, right? It's a very different scenario, okay? In the ER, everybody who comes in, whether they're coming in by ambulance, rolling in on a wheelchair, or walking in through the door, everybody gets an initial screening where they get a triage level to see whether they're about to die, which is a level 1 triage, or they need their stitches removed. That's a level 5 triage, right? And because of that, there's a wait, because you can be there with a busted wrist waiting to be seen when a trauma rolls in, or a stroke rolls in, or a heart attack rolls in, and the priorities change, right? Emergency rooms don't see patients based in the order that they came in. They see them based on the order in which they might die. Cost. Let's talk a little bit about that. So the cost of care, this is for like a non-life-threatening illness, okay? The cost of getting treatment in an ER compared to the cost of an urgent care is about 10 to 20 times higher in an ER, just on average, okay? And the reason for that is because the ER has to be ready 24 hours a day to take care of the worst of the worst. They have CT warmed up and ready to go. They have somebody to run the CT scanner. They have a radiologist ready to read the CT scan you might need. They have all the medications and the fresh blood that you might need in the event that you're bleeding really badly. They have access to a helicopter pad with a helicopter that's available to reach. So the cost of doing that kind of care is expensive. And as a result, getting those non-life-threatening illnesses done there is going to be an expensive way to approach that. Next. So if something happens and you're faced with a scenario where you or a loved one has been injured or you're feeling very sick, there are three really important questions to ask yourself. The first one is, could this be life-threatening? If you say yes to that question, the ER is the place to go, whether you get there by 911, or you have somebody take you, or you take the person yourself. That's really where you want to be. Notice it doesn't say, is this life-threatening? Because you don't know. You're not physicians. You're not healthcare providers. But if you're thinking this could be, that's the place to be. Okay? If it isn't that level, then the question is, would waiting until tomorrow be potentially dangerous? And the answer to that is yes, the urgent care is where you want to go, because they can get you in that day, take care of it, and send you home to enjoy the rest of your day. Okay? If waiting until tomorrow isn't necessarily an issue, then maybe call in your primary care office to see if they can work you in. And if they can't, you can still come back to the urgent care, right? It's a great backup plan that way. Let's talk about a little bit of a couple of red flags here. Let's Graham again, right? Chest pain. Chest pain, none of the things that are associated with severe chest pain are good. Okay. You can have a heart attack. You can get a tear in your aorta like Lindsay did. You can have a big blood clot in your lung that can kill you. Okay. All of that kind of stuff really is most appropriate for an emergency room. Excuse me. Stroke symptoms. If you're having any symptoms that are suggestive of a stroke, any ideas of what those might be? No guesses? I'll run over a few. Go ahead. Go ahead.
Slurred speech?
Yeah, slurred speech, a sudden change in your ability to speak, sudden change in your ability to move one of your extremities, a sudden loss of vision. Okay, all of those are stroke symptoms. A sudden change in your ability to feel sensation normally, a sudden onset of dizziness where you're spinning and you can't get control of it. All of those are potential stroke symptoms. There is a 3-hour window once those symptoms start in which they can treat you with a clot busting medication, help open that artery back up that's blocked in the brain. Okay, the timer starts right then. If it goes past 3 hours, the chances of a full recovery diminish dramatically. I need more water. Right. Severe bleeding, and by severe bleeding, what I'm talking about is pulsatile bleeding, bleeding that's like spurting. Okay, that's a bigger blood vessel that you want to handle, or bleeding that you can't stop with direct pressure. Right, you grab a washcloth and you apply firm pressure, and it's bleeding through that area. ER. Difficulty breathing, and I'm not talking about a little cough or something like that. I mean, so you're struggling to breathe, can't catch your breath. Severe allergic reactions, facial swelling, mouth swelling, throat swelling, that kind of allergic reaction, not eczema, right? Not an itchy hand or something like that. Next. All right, what we excel at, one more time, quick summary in the urgent care: colds, flus, cuts, abrasions, urinary tract infections, skin rashes, minor fractures, dislocations, fingers and toes and things like that. We do all of that stuff. Stomach bugs as well. Ear infections, sinus infections. So we have the red zone, which is the red flags always to the ER. We have the urgent care stuff, and now there's like this gray zone in between. Okay. There are some things that are great mimics, some symptoms that can have really catastrophic causes versus really benign, kind of nothing causes, right? Headaches are a good one. Headaches can be a migraine, tension headache, too much stress, too much reading, or a headache can be that, which is an aneurysm that blew up in somebody's brain. Okay. They both present as a really bad headache. Abdominal pain. Abdominal pain is a tough one because the belly is a black box. You don't really know what's going on in there perfectly until you can image the area. You can kind of, look for some things that can kind of clue you if something is bad. Like if somebody's got a lot of vomiting and a fever with their abdominal pain, I'm worried about an appendicitis in that patient. They need to go to the ER so that they can get lab work and a CAT scan done. But if somebody is just feeling a little nauseated because they ate something last night that didn't agree with them, that's different. Pelvic pain, that could be menstrual pain, or it could be a twisted ovary, could be a twisted testicle, it could be a twisted loop of bowel, or an incarcerated hernia. You never know. So, so when you're not sure, the big issue here is when you're not sure, don't let the fact that you're not sure keep you from deciding to go ahead and be seen. Doesn't really matter, okay? If it's one of those in-between things, just get to care. Doesn't matter where. If you show up in my urgent care and you've got something that I look at you and I go, okay, this really needs to be in the emergency room, you'll probably be one of the 3 or 4 patients that I'll send to the ER that day, okay? But you might be the other 25 that I'm able to treat right there, okay? In the ER providers see patients all day long. They came in thinking, worried that they were going to have something terrible happening. And they get tested, everything looks okay, they get reassured, and they're discharged home. And both of those scenarios, they're both, that's the way you want it to go. So just make sure you get the care you need. In conclusion, really it's about getting the right care, the right place at the right time. All right. Questions? Anybody?
Kidney stone.
Kidney stones. Yeah, tough one. So sometimes people have a history of kidney stones. It can kind of clue you in. They come in and they say, yeah, I've got this flank pain, just like I had the last 3 times I had kidney stones, right? The thing that we look for when somebody's having a kidney stone is, are you also having a fever? Because if you have an infection with a kidney stone, that can be very dangerous very quickly because patients will get sepsis. They'll get an overwhelming infection from that. So if it's kind of a benign thing, intermittent flank pain, maybe a little nausea with that, I think we have time to check the urine, see if there's any blood in the urine to help discern that. If I need to, I can send you over for a non-contrast CAT scan at the hospital and confirm that it's a kidney stone and that it's moving along. Oh, yeah. Great question.
Broken bone. If you're wondering if you maybe just sprained your ankle or broke your ankle and you're not sure.
Well, as long as your fingers don't look like that guy's fingers. Yeah. Yeah, I mean, that's a great thing to come in for, right? We see that all day long in the urgent care. People come in, they twisted their ankle really badly and they can't bear weight on it. So we take a look at it and get the x-ray and either way, if it's broken, we can treat it. If it's a sprain, we can treat that too. If it's broken and dislocated and needs some kind of a reduction, I'll probably be arranging for you to go to the ER and calling the ER ahead of time to let them know you're coming.
Dr. Charlebois, we have a question online. It says, I was in the hospital and was told to follow up with my primary care doctor. I don't have one. Can urgent care help?
Yeah, in two ways. We can see you for a visit in the after hospital setting that way. And the other thing that can happen when you're in our urgent care, we can arrange for you to have a PCP in the future as well. So we do that a lot.
What if you can't get an appointment with your PCP within the 6 days or whatever from they say to see?
You mean to treat a condition or an illness or something like that?
Yeah. And they
Yeah.
say, see your PCP within 5 or 6 days or whatever it
Yeah.
is.
Right. You mean like after a hospital
I
stay?
guess more I'm thinking of a hospital stay. So
Yeah.
I'm on.
So with Northern Arizona Healthcare, it's kind of interesting. They have a doc of the day that's available at most of the facilities. That's there specifically to see hospital follow-ups in a timely manner and things like that. But if you need something followed up upon and you can't get in for that appointment, we will see you in the urgent care.
Okay.
Right. What we're really good at is putting out a small fire, right? If it's a big fire, the ER is better at that kind of stuff. But if it's a small fire that needs something now, we can do that and then hand you back off to your PCP after.
I think like norovirus.
Norovirus? Yeah. So, the main symptom you'll have with that is nausea, vomiting, fever, headache, and diarrhea, right? And we saw that all winter long. But patients will come in. We can set up to do a stool study to confirm that's norovirus. We don't have the ability in our urgent care to do IV fluids, right? Because we don't have a registered nurse to run IVs and things like that. But we can test you for norovirus. We can prescribe medication to help with the nausea and vomiting. We can prescribe medication to help with the diarrhea.
We have another question online.
Sure.
There is a cyclospora, did I say that right? Cyclospora
Yep.
outbreak right now. Would those symptoms be for urgent care?
Yeah. I saw probably 3 or 4 patients with symptoms suggestive of that yesterday. I personally have not seen a positive case here yet, but I know as of yesterday, we had 19 cases in Arizona that popped up. But we can do the same stool study that does for norovirus. It's a PCR study that we can order and you can have done. And if it's positive, we can treat you with Bactrim, which is the drug of choice.
Yep.
Yes.
If you make a urgent care appointment with like slight abdominal pain and it progresses while you're waiting, would you like bump them to the front and triage like an ED or send them to the ED?
Yeah, sometimes like things are cooking and we're really busy and somebody walks in and they're like dripping blood, we take people a little bit out of turn. So we don't really call them appointments. They're estimated times of being seen. So less than the ED does in terms of triaging. We still have a little bit of a triage process of our own, which usually is the registration person going, and they come around and look at whatever's going on. Okay, and I go, oh yeah, let's get that into a room, put some pressure on it in the meantime, and then see you afterward, that kind of thing. But we're not usually talking about like an hour or 2 hours of a delay for something like that. We're talking about minutes. Yeah. Anything else online?
See, I think that's it. Oh, maybe. Yes, somebody take. Oh, they said you answered their question. Fine, thank you.
Anybody else have a question? Thank you very much for the opportunity. Right, I'm glad. Thanks.
I think this is great information to share. And like I said, we do have it available on our YouTube channel. That usually takes about 2 weeks for us to get it up there and going. If you found this information helpful, please share with people that you know.
Tell a friend. Tell a friend.
Yeah, absolutely. And I think what I have a takeaway from it, the thing that I kind of picked up on Dr. Charlebois is like the choice to seek medical care and help. You're not making a wrong choice, whether you're going to urgent care or the emergency department or someone's driving you, because you're getting the care. And if you do go to urgent care and, Dr. Rich would think you need to go to the emergency department, they're going to call 911. They're going to get that ambulance there and they're going to take you. So and in that process, they're going to treat you and get you to the best place possible so that you can then be transported on to the emergency department. And then that connecting phone call where, you know, he's on the phone, he's like, hey, I'm sending this over, this is what it looks like to me, and giving a heads up so that there's time to prepare for what might happen once you arrive. So thank you very much for coming this evening. I do appreciate your attendance. And we do also offer our Meet Our Expert live series up in Flagstaff. We alternate between Verde Valley Medical Center and Flagstaff Medical Center. So Maggie has an upcoming one next month in the month of August. Would you mind sharing what that is, Maggie?
Sure, we have Dr. Layla Nogrechi. She's one of our primary care providers up there, and she will be talking on insomnia. You know, why we struggle to sleep and some of the things we can do to help us sleep. So that will also be available online as well as in person. So
I know last month I was up at Flagstaff with Maggie, and Dr. Payne had talked about dementia and why you probably don't have it. So it was kind of nice, you know, him explaining, you know, because I think so many of us, I often think, I'm like, do I have early onset? I would go to, I go to the kitchen to get something. I'm like, what did I come out here for? And he was just talking about, and he gave us some really good scenarios. So please check that out online. We've got Dr. Nagaraj, which is a general surgeon here at VBMC. She was talking about colon cancer. She's got a great one on colon cancer, how to get your increased fiber kind of thing. We do colonoscopies here. I know a lot of people have asked endoscopies, colonoscopies. You can get them right here at VBMC. Let's see, who else did we have? We had Nancy Payne, who works in our behavioral health department. She was talking about mental health and aging and how you know, that goes hand in hand. And so that's available on our website. Prostate cancer, that was also done by Dr. Greer, Dr. Rice. Dr. Conlon. So we're starting our library on our YouTube channel. So I think it's very exciting that we have these things available so that if people have a question, you know, everybody consults Dr. Google. We like to think we have experts. They are trained physicians with so much wealth of experience and knowledge that you're going to hear great information directly from a source that is absolutely trustworthy. Because like ChatGPT created that picture for you, you know, for the slide, you know, it's gathering information from all these different places. Doesn't mean it's from physicians. It could be somebody on the keyboard going, oh, you know, I think it could be this. Yeah, so we always encourage everybody to make sure that you're getting your source of information from somebody qualified to give that to you. So
How do you get onto your website? On YouTube, how do you get on?
if you go to YouTube
Mm-hmm.
and then look up Northern Arizona Healthcare.
Spelled out.
Yep.
Okay.
Yep, spell out the whole Northern Arizona Healthcare. That channel will pull up. And then once you click on that channel, it'll give you a bunch of different options.
Yeah, I need to see it. Somebody that you was talking about.
one of the neat things, in addition to like the resources, you know, of our Meet Our Experts, you'll also see other things that say Meet Our Expert. All of our physicians and APPs, which would be our nurse practitioners and our physician assistants, they have videos on there. So you can get to know them and see a snapshot or a window by watching the video to kind of get to an idea whether you're like, oh, well, what do they do? And you can look it up by, you know, a specialty. If you're wondering, oh, who does, you know, maybe who works in orthopedics and who does knee replacements or that kind of thing. So all of our different specialties that are available at both hospitals are then listed on the YouTube channel, and you can look up different doctors. Maybe your primary care physician says you should, you know, have something done by a specialist. You have the opportunity to go out and look on our YouTube channel and just see a little bit of information about that doctor before you ever meet them. That's always, they talk about their philosophy, their care philosophy. And it'll also tell you where they practice at, whether it's at FMC, whether it's at Sedona. We have some physicians that go to Flagstaff and to Sedona. We have some physicians that are here in Cottonwood that also go to the Camp Verde. So it just gives you different locations that are available. So.
If you go under YouTube onto the Northern Arizona Healthcare Channel, and if you click on playlists, you'll see it says Meet Our Experts Live,
Okay,
and that's where you'll find it.
okay. Thanks.
You're welcome.
Absolutely. Any other questions? All right, well, thank you so much for coming. Please feel free to take a snack. We've got plenty.
I'm gonna have that cookie now.
Oh, good.